So today we're answering a user question from Linda Rajewski, who asks the difference between myelomalacia and myelopathy, which is actually a very good question, a very advanced question. And as always, if you have questions, use the hashtag AskDrJ. We're happy to answer it. So below are the images of two patients that came into my clinic. One of them had basically no symptomatology, just came in because of an incidental finding that was discovered during an accident. The other patient came in barely able to walk and barely able to use their arms. As you can see in both cases, there's a large disc that's bulging, that's pushing and indenting on the spinal cord. And in both cases, there is changes in the actual color of the spinal cord, which signifies swelling or edema. So chronic compression of the spinal cord itself can lead to myelomalacia. Myelomalacia is damage to the nerves that are passing within the spinal cord, and as a result of that, the spinal cord tends to get thinner, and on the MRI scan, you'll start seeing signs of diminished caliber of the cord itself. By contrast, myelopathy is a clinical symptomatology that's a symptom of spinal cord compression. In myelopathy, typically signs and symptoms of the spinal cord is not carrying signals from the brain to the rest of the body. This can include things like balance and coordination problems. It can include wobbliness. It can include problems with gaits. It can include problems with reflexes, such as sometimes patients can be hyperreflexic, meaning that the reflexes tend to be exaggerated. It can include what are called pathological reflexes, such as a Babinski sign, a Hoffman, or a sustained clonus, which is a sign that the inhibition that the brain usually provides to the muscles and tendons and joints are absent. So both myelomalacia and myelopathy are both extremely important radiographic findings as it pertains to surgery. Myelopathy, particularly when it's related to a compressive lesion, is almost always a surgical indication. Myelomalacia can be something that exists even after successful surgery. So in cases of chronic compression where the spinal cord has been damaged, even years later, you may see signs of persistent damage to the spinal cord, and that's known as myelomalacia. So it was a good question. Hopefully, if you have any other further questions, feel free to contact us.